This lesson discusses about Integrated Child Development Services Scheme, one of the most successful schemes of Government of India. The major purpose of this chapter is to introduce the learner to the background of the program, objectives, structure, training of the ICDS functionaries, organization and achievements of the program. Let's look into the objectives. After the completion of this module, you should be able to explain the historical background of the program, explain the objectives and structure of the program, explain the training of the functionaries and functioning of the programs, explain the achievements of the program. Background. According to the 2011 census of India, the children's population, that is of the age 0 to 18, is 427 million, which is round about 39% of India's population. Children in the age group of 0 to 6 years constitute around 158 million of the population of India. In 1970s, 90% of the India's children were suffering from malnutrition, about 1 lakh coming to it every month. India's infant mortality rate was 120 children per thousand, putting it in the 27th position from the top in a list of 130 countries. Ministry of Women and Child Development is implementing various schemes for welfare, development and protection of children. Many committees were set up to evaluate health, planning, committees, education, commission. Declaration of the Rights of Child in the year 1959. WHO and UNICEF and other international agencies all have contributed towards the adoption of National Policy for Children in India in 1974. The preamble of the policy described children as a supremely important asset and their nurture and solicitude are our responsibility. To implement this policy, Multi-Sectorial Integrated Child Development Services, that is ICDS, program was introduced on October 2nd, 1975. Services under ICDS. ICDS scheme covers children below the age of 6 years, expectant mothers and nursing mothers, and other women in the age group of 15 to 44 years belonging to the poor families and adolescent girls between 11 to 18 years. It aims at the delivery of the packages of services such as number 1, supplementary nutrition, number 2, preschool non-formal education, number 3, nutrition and health education, number 4, immunization, number 5, health checkups, and number 6, referral services. The last 3 services are related to health and are provided by the Ministry or Department of Health and Family Welfare through National Rural Health Mission, that is NHRM, and health system. The perception of providing a package of services is based primarily on the consideration that the overall impact will be much larger if the different services develop in an integrated manner, as the efficacy of a particular service depends upon the support it receives from the related services. For better governance in the delivery of the scheme, convergence is therefore one of the key features of the ICDS scheme. This convergence is inbuilt in the scheme, which provides a platform in form of Anganwadi centers for providing all services under the scheme. This is a centrally sponsored scheme administered through the state governments. It was taken up on an experimental basis in 33 ICDS project areas during the year 1975-76. Subsequently, the scheme has been expanded to throughout the country. In addition to the central government, state governments also take up additional projects. The entire expenditure of the centrally sponsored ICDS projects, except for the supplementary nutrition component, is borne by the Government of India in the form of grants in aid to states. The component which is not covered by the central government is funded by the state governments. Administrative structure. Generally, there is one Anganwadi for population of about 1000 in rural and urban areas and 700 in tribal, hilly and sparsely populated areas. However, based on the local needs, the number of Anganwadis can be increased. The Anganwadi is run by an Anganwadi worker having high school level education, belonging to the local community, who have undergone 3 months of training in personal hygiene, treatment of minor ailments, perinatal care, child development, immunization and identification of child at risk. She gets honorarium as an incentive. Anganwadi worker is assisted by Anganwadi helper. Above Anganwadi worker, supervisor is appointed to supervise the work who is a full-time government employee. The administrative unit of an ICDS project is a block or taluk in rural or tribal areas and a group of wards or slums in urban areas. A child development project officer is in charge of an ICDS project. The CDPO is an overall in charge of an ICDS project and is responsible for planning and implementation of the project. A CDPO is supported by a team of 4 to 5 supervisors who guide and supervise Anganwadi workers, and the number of Anganwadis is 150 or more in a rural project and 100 or more in tribal or hilly area. 1 or more assistant or additional CDPOs are sanctioned to assist the CDPO. A supervisor has the responsibility of supervising 20, 25 and 17 Anganwadi workers in rural, urban and tribal projects respectively. A supervisor guides an Anganwadi worker in planning and organizing delivering of ICDS services at the Anganwadi center and also gives on the spot guidance and training as and when required. District program officers, that is DPOs, are supervisors for the district. Health services in ICDS are given by the team of primary healthcare centers, health functionaries who are comprising of medical officers, lady health officer, A&M and female health worker. At the community level, ASHA will assist. ICDS team: 1. Anganwadi helpers, 2. Anganwadi workers, 3. Supervisors, 4. Child development project officers, that is CDPOs, district program officers, DPOs. Anganwadi worker is also an agent of social change, mobilizing community support for better care of young girls, children and women. Besides the medical officers, auxiliary nurse midwife and accredited social health activist, that is ASHA worker, form a team with the ICDS functionaries to achieve convergence of different services. Honorarium to Anganwadi workers and Anganwadi helpers. Anganwadi workers and Anganwadi helpers, being honorarium workers, are paid a monthly honorarium as decided by the government from time to time. Now, let us look into the ICDS beneficiaries and the services. Children less than 3 years, supplementary nutrition, growth monitoring, immunization, health checkup and referral services are the services provided. For the children between 3 to 6 years, non-formal preschool education, supplementary nutrition, growth monitoring, immunization, health checkup, referral services. For expectant and nursing mothers, health checkup, tetanus toxoid immunization to pregnant women, supplementary nutrition, nutrition and health education. For other women in between age of 15 to 45 years and adolescent girls between 11 to 18 years, the services which are provided are nutrition and health education, IFA supplementation and deworming intervention, non-formal education, home-based skill training and vocational training, supplementary nutrition. Funding pattern. Prior to 2005-2006, providing of supplementary nutrition was the responsibility of the states and administrative cost was provided by the Government of India as 100% central assistance. Since 2009-10, Government of India has modified the sharing pattern of the ICDS scheme between the centre and the states. The sharing pattern of the supplementary nutrition in respect of northeastern states between the centre and the state has been changed from 50-50% to 90-10 ratios. In respect of other states or union territories, the existing sharing pattern is in the respect of supplementary nutrition, which is at 50-50%. The existing cost sharing ratio for other components is 90-10, except the new components approved under strengthening and restructuring, for which it is 75-25, whereas 90 and 10 for NER. Revised nutrition and feeding norms under supplementary nutrition component of ICDS. Provision of supplementary nutrition under the ICDS scheme is primarily made to bridge the gap between the recommended dietary allowances and the average daily intake of children and pregnant and lactating women. Under the revised nutritional and feeding norms, that is from 2009, state governments or union territories have been requested to provide 300 days of supplementary food to the beneficiaries in a year, which would entail giving more than one meal to the children from 3 to 6 years who visit Anganwadi centers. This includes morning snacks in form of milk or banana, egg or seasonal fruits or micronutrient fortified food, followed by hot cooked meal. For children below 3 years of age, pregnant and lactating mothers, take home rations in form of pre-mixers, ready to eat food are provided. Besides, for severely underweight children in the age group of 6 months to 6 years, additional food items in the form of micronutrients fortified food and or energy dense food as THR is provided. These norms have also been endorsed by the Supreme Court in order dated 22/4/2009. Registration of beneficiaries. All children below 6 years of age, pregnant women and lactating mothers are eligible for availing of services under the ICDS scheme. BPL is not a criterion for registration of the beneficiaries under ICDS. The scheme is universal for all the categories of beneficiaries and in coverage. Key features of strengthened and restructured ICDS inter alia include addressing the gaps and challenges with programmatic reforms, repositioning the Anganwadi center as a vibrant ECD center to become the first village outpost for health, nutrition and early learning, minimum of 6 hours of working, etc. Construction of Anganwadi center building and revision of rent including upgradation, maintenance, improvement and repair. Strengthening package of services, strengthening ECCE, focus on under 3's care and nutrition, counseling services for mothers of under 3S and management of severe and moderate underweight. Improving supplementary nutrition program with revision of cost norms. Management of severe and moderate underweight, identification and management of severe and moderate underweight through community based interventions, Sneha Shivers, etc. Strengthening training and capacity as well as technical human resources, etc. Management reforms, decentralized planning, management and flexible architecture, introduction of annual program of implementation plan, that is APIP, and flexibility to states for innovations, ensuring convergence at all levels including the grassroots level, strengthening governance including PRIs, civil society and institutional partnerships with norms of up to 10% projects to be implemented in collaboration with such agencies, strengthening of ICDS, management information systems, using information communication technology, that is ICT, web enabled MIS and use of mobile telephones, etc. Deploying adequate human and financial resources with revision of some of the existing norms in components, training, etc. Introducing new items such as pool of untied flexi fund for promoting voluntary action, local innovations, Anganwadi cum creche, additional worker and link worker, provision for children in special needs, etc. Institutional reforms. ICDS in mission mode with missions at national, state and district levels, introducing APIPs and MOUs with states or union territories. Technical and management support for ICDS at various levels, hitherto not available. Delivery of quality services with measured inputs, processes, outputs and outcomes. Mission to report to the Prime Minister's Council at national level and to the CM's Council at the state level on nutrition, child development, including early learning, etc. State Child Development Society will be set up at the state level with powers to set up its district units. Fund transfer of the ICDS mission will be channeled through the consolidated fund of the state. However, in the event the state fails to transfer the funds within 15 days, it will be liable to pay interest on the amount of the pattern of release for the finance. Commission funds. Nutrition counselor cum additional worker in 200 high burden districts and link workers in other districts will be on demand by state government approved through APIPs by EPC. District machine unit would be set up as per the phasing plan of the ICDS mission. Besides, district ICDS cells to continue to operate as per existing norms and district cells to be set up in those districts where the cell is not existing. Constitution of a mission steering group and empowered program committee at national and state levels for effective planning, implementation, monitoring and supervision of ICDS mission. Creating of a separate ICDS mission budget head to allow flexibility and integration within the child development and nutrition sectors and for convergent action with wider determinants of maternal and child undernutrition. The ICDS mission targets would be to attain three main outcomes, mainly prevent and reduce young children undernutrition, that is percentage underweight children 0 to 3 years by 10 percentage point. 2. Enhance early development and learning outcomes in all children in the age group of 0 to 6 years, improve care and nutrition of girls and women and reduce anemia prevalence in young children, girls and women by 1/5 annual health survey and district level household survey to be used as baseline for measuring the outcomes of ICDS mission. To strengthen training and capacity building. Roles and responsibilities of Anganwadi workers. Few key roles of Anganwadi workers are to elicit community support and participation in running the program, to weigh each child every month, record the weight graphically on the growth card, use referral card for referring cases of children or mothers to the subcenters of PHCs, and maintain child cards for children below 6 years and produce these cards before visiting medical and paramedical personnel. To carry out a quick survey of all the families, especially mothers and children in those families in their respective area of work once a year. To organize non-formal preschool activities in the Anganwadi of children in the age group of 3 to 6 years and to help in designing the making of toys and play equipment for indigenous origin for the use in Anganwadi. To organize supplementary nutrition feeding program for children and expectant and nursing mothers by planning a menu based on the locally available food and local recipes. To provide health and nutrition, education and counseling on breastfeeding, infant and young feeding practices to mothers. Anganwadi workers shall share the information relating to birth that took place during the month with the Panchayat Secretary or Gram Sabha Sevak or the ANM. To make home visits for educating parents to enable mothers to plan an effective role in the child's growth and development with special emphasis on newborn child. Let's look into the roles and responsibilities of Anganwadi helpers. To cook and serve the food to children and marchers, to clean the Anganwadi premises daily and fetching water, cleanliness of small children, to bring small children collecting from village to the Anganwadi. Training of ICDS functionaries and trainers. NIPCCD is an apex institute for planning, coordination and monitoring training of ICDS functionaries and trainers. The training centers are established in many other places to train the ICDS staff. Existing monitoring system under ICDS scheme. Monitoring mechanism. A Ministry of Women and Child Development has the overall responsibility of monitoring the ICDS scheme. There exists a central level ICDS monitoring unit in the ministry which is responsible for collection and analysis of the periodic work reports received from the state in the prescribed formats, records and registers at the AWC level, at the Anganwadi level and monthly half-yearly progress reports at the block and Anganwadi levels have been prescribed. States, union territories are required to compile the information and send the state level consolidated reports to Ministry of Women and Child Development on number of operational projects, Anganwadi centers, number of beneficiaries of supplementary nutrition and preschool education and nutritional status of children. The information received in the prescribed formats is compiled, processed and analyzed at the central level on quarterly basis. The progress and shortfalls indicated in the reports on ICDS are reviewed by the ministry with the state governments regularly by reviewing meetings and field visits. Wheat based nutrition program. Under the wheat based nutrition program, food grains such as wheat, rice and other coarse grains are allocated at below poverty line rates to the states or union territories through the Department of Food and Public Distribution for preparation of supplementary food in ICDS. Supplementary nutrition. National Food Security Act was promulgated by the Government of India through the Gazette notification dated 10/9/2013. In view of the supplementary nutrition program, which is one of the 6 services under ICDS, has been made as an entitlement under the NFSA according to section 4, 5, 6 and 7 of the NFSA pertain to ICDS and IGMSY schemes of the ministry. Welfare measures for the Anganwadi workers and Anganwadi helpers. Anganwadi Karyakarti Bhima Yojana AKBY. AKBY under the LIC's Social Security Scheme is one of the welfare measures extended to the grassroots functionaries of the ICDS scheme. The Government of India has introduced the Anganwadi Karyakartas Bhima Yojana with effect from 1/4/2004. Female critical illness benefit. An amount of rupees 20,000 is payable on diagnosis of invasive cancer, malignant tumor, manifest in the organs such as breast, cervix, uteri, corpus uteri, ovaries, fallopian tubes, vena, valva, subject to proof of affliction satisfactory to corporation. Shiksha Sahyog through Anganwadi Karyakarti Bhima Yojana, which is a free add-on scholarship. Benefit is available for the children of Anganwadi workers covered under the AKBY scheme. Anganwadi centers infrastructure. It is necessary that the Anganwadi center is consolidated as the first village habitation post health, nutrition and early learning center or platform on which the 2 new schemes of Sabla and IGMSY are also implemented. As part of strengthening and restructuring of ICDS scheme, Government of India has approved provision for construction of 2 lakh Anganwadi center building at rupees 4.5 lakh per AWC building during the 12th plan period in a phased manner with cost sharing ratio of 75-25 between the center and the state other than the northeastern states, where it will be at the existing rate of 90-10. Convergence with other programs. States and union territories have been requested to tap in the funds for construction of Anganwadi centers or buildings from the various schemes such as MP LADS, MLA LADS, BRGF, RIDF, Panchayat Raj institutions, MNREGA and tribal affairs multi-sectorial development program of Ministry of Minority Affairs under SSA, Finance Commission, additional central assistance under State Plan, integrated action program for left-wing extremism districts, etc. Construction of Anganwadi center buildings has also been included in the list of permissible work in Schedule 1 under MGNREGA 2005. Cooperation with development partners. Several international agencies or development partners, including UNICEF, provide technical assistance to ICDS programs both at the central and state level. Some of them are Government of India UNICEF Program of Cooperation. The partnership between UNICEF and the Government of India spans over more than 60 years. The UNICEF have continued its support to government in enhancing systems and improving delivery of services to women and children, especially from the vulnerable and marginalized sectors. The basic agreement that provides basis of the relationship between the Government of India and UNICEF dates from 10th May 1949 and was amended on 5th April 1978. Over the last 65 years, a succession of country programs has been implemented in conformity with the basic agreement. Sneha Shivir, which is designed to be a community-based approach for the prevention and management of moderate and severe undernutrition. Sneha Shivir has been introduced in 200 high-burden districts of the country and is to be served through an additional Anganwadi worker or nutrition counselor at the Anganwadi center. Kishori Shakti Yojana. Under the ICDS program since 2000, Kishori Shakti Yojana is being implemented to empower adolescent girls so as to enable them to grow and develop to take charge of their lives. Let's summarize today's session. India adopted National Policy for Children in India in the year 1974. To implement this policy, Multi-Sectorial Integrated Child Development Services, that is ICDS program, was introduced on October 2, 1975.